Good evening, class. We're going to go over chapters 22, 23, 24, and 25, physiologic and behavioral adaptation of the newborn, nursing care of the newborn and family, newborn nutrition and feeding in the high-risk newborn. Chapter 22, physiologic and behavioral adaptations of the newborn. So transitions to the extrauterine life. The first period of reactivity, it lasts 30 minutes after birth. The newborn's heart rate will increase from 160 to 180 beats per minute and decreases after 30 minutes back to baseline. Infant is alert and has spontaneous startles, crying, and head movement. This period of decreased responsiveness lasts 60 to 100 minutes. The infant is pink. Respirations are rapid and shallow, up to 60 breaths per minute. In sleep or has a marked decrease in motor activity occurs. Second period of reactivity lasts about 10 minutes to several hours, and it occurs between 2 and 8 hours after birth. So tachycardia, tachypnea occur, meconium may be passed, and increased muscle tone, changes in the skin color, and mucus production will begin. Respiratory system, so initiation of breathing. Chemical factors, there's mechanical factors, thermal factors, sensory factors. Want to be aware of any signs of respiratory distress. Cardiovascular system, be aware of the heart rate and the heart sounds. Blood pressure and blood volume adjustments, unless the baby is in the neonatal intensive care unit or in the level 2 nursery, they may not have their blood pressure checked, but you want to be aware of any cardiovascular problems. Here's baby. Hematopoietic system, so the red blood cells and hemoglobin, leukocytes, platelets, blood groups. Here's mom and baby bonding, skin to skin. Thermogenic system, so heat loss is easily occurred. Thermogenesis, hypothermia, and cold stress, you want to be aware of that, and also want to be aware of the baby getting too hot. So usually the baby will wear a hat, diaper, 2 blankets to help them regulate their temperature. That can take about 24 hours to help them regulate their temperature, but you don't want to have them too hot or too cold. The renal system, so the fluid and electrolyte balances, so want to be aware of signs of renal system problems. The baby's cold, oxygen consumption goes up, the respiratory rate goes up. Shows you where it gets to metabolic acidosis. Gastrointestinal systems, digestion, meconium. Usually they pass the meconium within the first 24 hours of birth. Be aware of feeding behaviors, making sure the baby's eating as appropriately, and be aware of any GI problems. Hepatic systems, iron storage, glucose hemostasis, the fatty acid metabolism, bilirubin synthesis, so pathologic jaundice, that's usually checked at 24 to 36, usually 36 hours after birth. They're checked for the amount of bilirubin. Coagulation, drug metabolism, beware of signs of hepatic system problems. Beware of jaundice early. Immune systems, risk for infection. The hepatitis B vaccine is now given after birth. Integumentary systems, the sweat glands, desquamation, Mongolian spots may be on the back of the baby. Those are normal. Nevi and erythema toxicum, which is a normal newborn rash. It looks like little pimples. Normal. Here's a picture of Mongolian spots on the baby's behind, the little dark spots on its bottom. Respiratory system, so with the female, discharge is normal because of the extra estrogen while pregnant. It may look almost like a little bit of blood or amber colored crystals in the diaper. So male testes are possibly still descending. Want to be careful. Hydrocele is not common. Swelling of the breast tissue is also normal because of the extra estrogen with the mother that's the baby absorbs while in the uterus. Signs of risk of reproductive system problems. To be aware of those. Here, the baby's genitalia is much more swollen for the female. That's normal, as well as the male. You want to be careful. They don't have a hydrocele, though. Skeletal system, so cephalohematoma, that want to be aware of those. Subgleal hemorrhages, be aware of the spine, and there's no openings at the bottom of the spine. Looking for any pathology. Be aware of the extremities. Any like club footing, signs of risk of skeletal problems like hip dysplasia. So when you take the hips back and you kind of rotate back and forth with the hips, you don't want to hear that click. You want to make sure that the gluteal folds are the same on both sides of the baby, because if not, it could have hip dysplasia. Neuromuscular system, so newborn reflexes that are normal. This is a cephalohematoma and the subgleal hematoma. Subgleal hematoma is on the bottom, and the cephalohematoma is on the top right. Here's showing how the baby skull forms and how most babies look like this when they're delivered due to coming out of the birth canal. This is a demonstration of checking for hip dysplasia, behavioral adaptation, sleep-wake states. Other factors influencing behavior of the newborn could be gestational age, time, stimuli, and any medications that the mother has. If she had some pain medication, IV, right prior to delivering, the baby could be a lot more tired and lethargic. If she's getting pain medication, baby can be lethargic. Baby's alert and crying. Sensory behaviors, so vision, hearing, smell, taste, touch. Responsive to environmental stimuli, temperature, habituation, consolability, cuddleness, irritability, crying. So chapter 23, nursing care of the newborn and family, immediate care after birth, so birth through the first 2 hours. Initial assessment of the APGAR scoring, initial physical assessment, and APGAR scoring APGARs are done right after delivery. Physical assessment, general appearance, vital signs, baseline measurement for physical growth, so weight, head circumference, and body length, and the neurological assessment. Here's the estimator of gestational age by maturity. These are going to be usually in the nursery, but also available with the newborn nurse that delivers the infant. Well, it doesn't deliver the infant, but it's there during the delivery. Gestational age assessment, classification of newborns by gestational age and birth weight. Be either early term infant, late preterm, post preterm, or post mature infant. Immediate interventions after birth would be airway maintenance, maintaining adequate oxygen supply, eye prophylaxis, so the erythromycin placed in the eyes, and vitamin K prophylaxis to help with blood clotting, promoting parent-infant interaction. So this is when they're talking about the eyes and the vitamin K. It's put in the thigh, so they call it eyes and thighs. There's a suction bulb. Always push in the suction for the suction bulb before using it. Never put it in the baby's nose. If you put it in the baby's mouth, you're going to put it to the right or the left because you don't want to put it right down its throat and choke the baby. Say it again, don't put it in the nose. Do not push it when you place it in the nose or in the mouth. And when you do use it, it's already suctioned first, placed in the side of the baby's cheek, unsuctioned, suctioned first, placed in the side of the baby's cheek, and unsuctioned. Here's a demonstration of placing erythromycin in the baby's eyes. So common newborn problems can include birth injuries, physiologic problems like hyperbilirubinemia, assessment and screening is done, therapy for hyperbilirubinemia is phototherapy, and if needed, an exchange transfusion. Being aware of baby's glucose, so if baby's small for gestational age or large for gestational age, most likely they're going to be checked their hypoglycemia. Hypocalcemia, also that can be done as well. That baby has a bruised face. Baby may have come down the birth canal a little too fast. But when you're looking at the baby, you may think he's not breathing correctly because his jaw is purple and a little bit of his face is. So when babies usually come out bruised after birth, they may put on the side of their little bassinet that he has a bruised face. Here's the Billy check. They're checking the baby's bilirubin, and depending on the age of the baby, there'll be a chart that lets you know if this is too high or too low. Here's baby under Billy lights, and if you notice, the baby has eye coverings. They always have the eye covering so that they're not getting blasted with the Billy lights in their eyes. There's a picture. Some of the nurses draw eyelashes on those. Laboratory and diagnostic testing, so universal newborn screening is done. That checks for 23 genetic conditions. Newborn hearing screen is done. That can be done as early as 12 hours. That can be done earlier. If it's failed, it's always done at least one more time before the baby is sent out for hearing after it's discharged. And depending on if the baby has a lot of mucus, a lot of fluid, then it might not pass the first time. So critical congenital heart disease is also checked. You check the baby's oxygenation by checking around the foot and on the arm. And depending on the difference of oxygenation, it'll let you know if it's needs more follow-up. If needed, other testing could be venous puncture and urine specimen, which urine specimens are usually done to test for toxicology. Intervention, so infection control factors, preventing infant abduction, and preventing newborn injury are important. So preventing infant abduction is done with a hugs tag system. There's a band placed on the baby's arm and the leg very close after delivery before the baby leaves that room. Also, the hugs tag security system is placed on the baby's leg as well. None of those are removed or allowed to be removed until the baby is leaving the unit to go home. There's the hearing screen. So baby getting warm and has the little heart attachment to let you know how hot the baby is under the warmer. When getting blood from the baby's foot, also the baby's foot is in a diaper because most likely it has a warm pack in there, and getting the baby's foot warm so that we can do the newborn testing. If you look to the right of the screen, the baby's foot, you can see where all the nerves are. So you want to be careful not to hit any of those nerves when you're puncturing the baby's foot to get the blood. Here's a venous puncture on a very, very small baby. There's the hugs tag system. This one actually has the mother's hugs tag with it. We usually just have the hugs tag system on the baby's foot. And if that hugs tag is not setting up against the baby's skin, it will alarm as well if it's become a little too loose. Great system. Interventions, therapeutic and surgical procedures, so intramuscular injection. If needed, circumcision, policies and recommendations, parental decision. It's a procedure. The procedure usually is given pain management. Pain management is done with sucrose on the baby getting sucrose. That's actually pain management, as well as usually they'll numb the area. Most of the doctors numb the area. And then the care for the newly circumcised infant. Want to make sure you put lots and lots and lots and lots of the Vaseline on around the tip of the penis, keeping it moist until it heals, because the worst thing that could happen is that get unmoist and the baby's genitalia gets stuck to the diaper. Here's a picture of one of the utensils that they use for the circumcision. So the little cap here, let's see, where's the little cap? Little cap here is sitting over the top of the penis. This is the skin that's pulled up. This will all be razored off. And then this down here will be unscrewed. This piece will flip up and come off. And this little piece of skin will be gone. Here's a picture of the postpartum of the circumcision. It looks like they have a little bit of the gauze on there, and then this is healed. Neonatal pain, so neonatal pain responses to pain, the assessment of the neonatal pain, and management of neonatal pain and non-pharmacological management. This is done after circumcision. You are checking the baby every 15 minutes for the first hour before you send the baby back to make sure the baby, first of all, it's every 5 minutes for 15, and you're checking for any excessive bleeding, and if the baby's screaming and crying, give them some more of the sugar and the sucrose liquid, and that helps with their pain. Promoting parent and infant interaction, so discharge planning and parent education. Making sure that they're aware of when to call about the temperatures, the respirations. They're aware of feeding patterns, of when to feed the baby, aware of elimination and how many diapers should be for how many days old the baby is, sleeping, positioning, holding. Want to make sure that they do not have any toys, any little cute little toys in the crib. There shouldn't be anything in the crib other than the baby. Those really pretty nice fluffy blankets are nice and all, but if you hold that blanket up against the light and you can't see through it, the baby cannot breathe through it. So they're cute and all, but those aren't appropriate. Could get over the baby's face and cause a lot of problems. You want to be aware of rashes, diaper rash, newborn rash, the difference. Also, clothing, what's appropriate, car seat, safety. Make sure they have the car seat that's available for the baby. Some, not all, but some fire stations still help with a place in the car seat. Non-nutritive sucking, so some of that is normal. Bathing and umbilical cord care. Don't want to put anything on that umbilical cord. Let it fall off on its own. Putting moisturizer on it, witch hazel, or not appropriate. Let it fall off on its own. The baby does not need lotion. It's not because its skin is dry. That's the normal process of sloughing, the stuff sloughing off that was there and protecting the baby in the umbilical sac. In the amniotic sac. So infant follow-up care, so usually before they leave, they're already set up with an appointment to follow up with their primary care provider for the baby. Cardiopulmonary resuscitation is important. It would be a good idea for everybody in the household to be CPR certified. Practical suggestions for the first weeks at home, interpretive of crying and the use of quieting techniques. The baby has been in a belly for 36 plus weeks. It likes to feel wrapped up. The swaddle comforts the baby. So swaddling is comforting. And recognizing any signs of illness is important. Here's a baby that's very little, 5 pounds under, depends on the policy of the hospital. They usually do a car seat test. So they'll lay the baby up in the car seat, put the oxygen pulse ox on the baby, and let them sit there for a while to see if their oxygen stays appropriate or if their head starts to fall down and they can't breathe. That's why the car seat test is important. Here is removing the umbilical clamp. Just remove it, let the umbilical cord fall off on its own. Chapter 24, Newborn Nutrition and Feeding. So American Academy of Pediatrics recommends that babies or infants are breastfed exclusively for the first 6 months, and breastfeeding should continue for at least 12 months and thereafter as desired. Complementary foods may be introduced at 6 months of age. Breastfeeding rates is a goal for Healthy People 2020, and benefits of breastfeeding. Infant feeding decision making. Contraindications to breastfeeding could be a patient that is being treated with Suboxone, other medications that could interfere with breastfeeding. Cultural influences on infant feeding, so lactation and LGBTQI families. Nutritional needs. Fluids. Give them energy. Carbohydrates, fats, protein, vitamins, minerals, all those are important. Anatomy and physiology of lactation. So anatomy of the lactating breast, lactogenesis, uniqueness of human milk. Here's a picture of the glandular tissue, the main milk ducts, the subcutaneous fat, the intraglandular tissue. Supporting breastfeeding mothers and infants, so breastfeeding initiation, positioning, helping with positioning, latching, milk ejection or letdown. So if when a baby cries and the mother hears baby cries, usually she's going to let down a little bit of milk. Frequency of feedings, so every 2 to 3 hours. Duration of feedings, about 15 minutes. The most 15-20 minutes. If you continue to feed the baby for 30 minutes for just continuous, it's burning more calories than it's actually obtaining. So indicators of effective breastfeeding is baby should be producing urine and stool. Then supplements, bottles, and pacifiers as needed. Here's a lactating or probably a lactation consultant's class. Different ways of holding the baby for latching. There's the football hold and several other positions. Here is supplementing with trying to have the baby latch, but also adding a little bit of this supplement. Special considerations: a sleepy baby, a fussy baby, a baby with slow weight gain, jaundice, preterm infants, late-term infants, and breastfeeding multiple infants. All of those may need special consideration. Here's a picture of the breast pump and information on breast pump. Expressing and storing breast milk, so hand expression or mechanical expression by different types of breast pumps, and storage of the breast milk. You want to be aware of how long it can stay out, how long it can stay in the refrigerator, and how long it can stay in the freezer. Maternal employment. So weaning, milk banking, milk sharing. Here's different hand pumps of care of the mother. So it's important that she obtains appropriate nutrition, rest, care of her breast. Using some of the breast milk to rub around the areola is actually healing and can help with the cracking of the breast, as well as the cream. I forgot the name of it, the lanolin cream. is also helpful. Breastfeeding and contraception, so breastfeeding during pregnancy, breastfeeding after breast surgery, and breastfeeding and obesity. Medication, smoking, alcohol, caffeine, shouldn't be doing those while breastfeeding. Herbal preparations, want to be careful with those too, because anything that if you're breastfeeding, anything that you're consuming is getting to the baby. So something spicy may upset the baby's stomach. Something like cabbage and stuff that causes gas may upset the baby's stomach. Common concerns include engorgement, sore nipples, insufficient milk supply, plugged milk ducts, mastitis. And you want to make sure that the mother has the proper follow-up after hospital discharge. Here's cabbage leaves that's used to help with drying up the milk. Parent education, they need for formula feeding, need to be readiness for feeding, feeding patterns, feeding techniques, common concerns, and the difference is of what types of bottles or nipples that are needed. Here's two ways of holding the baby. Want to make sure if the baby stops eating, it's only like 5 mLs, you want to make sure that you hold it, burp the baby, and he'll probably eat a little bit more. Here's Dad, different ways of burping. And infant formulas, so there's commercial formulas, there's formula preparations, vitamin and mineral supplementations are usually added to the formulas. Weaning if needed, if not, they may be needed. Weaning and complementary feeding, introducing solid foods. Chapter 25, the high-risk newborn. So conditions are circumstances that superimposed on normal course of events associated with birth and adjustment to extrauterine existence. This could be a birth trauma, maternal substance abuse, infection, or congenital anomalies. Birth injuries sustained during labor and birth injuries may be avoidable. So ultrasound allows antepartum diagnosis of macrosomia, so large baby, hydrocephalus, and unusual presentations of the baby. Elective C-section or birth chosen for some pregnancies to prevent the significant birth injury. Case care management, skeletal injuries, so peripheral nerve system injuries, or palsies, facial paralysis, or neurologic injuries. Here's a broken clavicle, birth injury. Sepsis, so neonatal infections, patterns early onset or congenital. It can be a non-sociomal infection or late onset. Care management, you want to be aware of signs of neonatal sepsis. Laboratory studies will be performed. Any treatment that is needed, antibiotics and assessment and prevention is important. Torch complex, so toxoplasmosis, other Hep B, HIV, parvovirus, West Nile, rubella, cytomegalovirus, and herpes simplex virus, and be aware of care management for maternal infections. Drug-exposed infants, so maternal drug use, addiction, care management, alcohol exposure, cocaine exposure. That baby is going to be crying a lot and need to be held. It's very sad to watch these babies go through withdrawals. Meth exposure, marijuana exposure, selective serotonin reuptake inhibitors, and care management. So patient that's been on antidepressants as well. Hemolytic disorders, so blood incompatibility. So RH incompatibility, only RH positive offspring of an RH negative mother are at risk. So if the fetus is RH positive and the mother is RH negative, the mother forms antibodies against the fetal blood cells. So she will need RhoGAM prior to after birth, prior to having another baby, so that she doesn't fight the antibodies against the next baby's blood cells. So RBO incompatibility. Characteristics, infants with diabetics mothers, they're usually large, macrosomia, increased risk of birth injuries because they are so large, and increased in congenital anomalies. So nursing care would be adequate thermoregulation, carb feedings as appropriate, to making sure they're getting enough. They may need supplementation. and checking their serum glucose levels. This is a picture of a macrosomic baby. It's just a very large baby. Usually these babies are don't do very well feeding. I mean, they do okay feeding. They're hungry, but sometimes they're a little slow to catch on. Congenital anomalies, the increased incidence, the leading cause of death of infants under the age of 1 is most detected at birth or shortly after, and surgical techniques and treatment are available, and there's an interdisciplinary team. Most common major congenital anomalies could be cleft lip and palate, esophageal atresia, tracheoesophageal fistula, gastroschisis, congenital cardiac defects, congenital diaphragmatic hernia, neural tube defects, myomeningocele. That's what you want to check when you're going down and feeling down the spine when you're doing your assessment of the baby. Developmental dysplasia of the hip or club foot. Want to be aware of those. Hypospadias, as well as disorders of sexual development or bladder exstrophy. Preterm infants, care management, late preterm infants, post-term infants. So complications of preterm infants include respiratory distress syndrome, other respiratory disorders, necrotizing enterocolitis. Want to be aware of. It's a baby. Preterm infant. So it's an infant born before 37 weeks gestation, immaturity or most organ systems, and actual cause is unknown, and distinct characteristics. So small, scrawny, large head, translucent skin, a lot of lanugo. Late preterm are born between 34 and 36 and 6 to 37 weeks of gestation is referred to as late preterm rather than near term. Higher risk of problems with thermoregulation, hypoglycemia, hyperbilirubinemia, sepsis, and respiratory function. So post-term infants, gestation that extends beyond 42 weeks, it's about 3.5 to 15% of pregnancies. The cause of delayed labor is unknown, which placental dysfunction can occur, like the calcified placenta, as I was talking about weeks prior. Significant increase in fetal and neonatal mortality and current fetal distress because their environment is too small for the baby. Increased risk of birth injuries. High risk care of high-risk newborn and family will include assessment, respiratory support if needed, thermoregulation, so thermal stability, neutral thermal environment, maybe an incubator, maybe skin-to-skin or kangaroo care. Here is a baby getting suctioned. Protection from infection, standard precautions, so gloves, washing hands, hydration, nutrition, breastfeeding, transition to oral feedings if the baby is being gravage fed or via nasogastric tube, and bottle feeding, gravage feeding. Here's a baby with oxygen as well as being fed with a feeding tube. Energy conservation is important. Skin care is important. Developmental outcomes are assessed. Family support and involvement, facilitating parental-infant relationships, and discharge planning and home care. Neonatal, if there's neonatal loss, the patient may want the baby to be baptized. Inborn errors of metabolism, congenital hypothyroidism, PKU, glycostemia. Genetic evaluation and counseling may be needed with the newborn screening. Here's dad adapting with baby. That is the end of chapter 25.